We're continuing our video series on lung cancer, and today's topic is diagnosing. How is lung cancer diagnosed and the different methods that are used? Doctor?
Well, Counselor, the most important first step in diagnosing lung cancer is for a physician to perform an examination of the lungs, usually with a stethoscope, and listen for any abnormal sounds or difficulty in the lungs to expand. That usually initiates if the patient has complaints that are consistent for a risk of lung cancer. It results in performing a chest x-ray, simple imaging study that looks for abnormalities, masses, and potentially fluid in the lungs that may be diagnostic of a carcinoma. More advanced imaging can be performed with CT scans, which are very helpful, and less commonly MRIs. And these can give two-dimensional images in cross-sections through the entire lungs to look again for masses and presence of fluid or abnormal arteries and veins. One of the more common screening methods that's rather inexpensive is called sputum cytology, where a patient coughs a sample into a cup, and that's looked at under a laboratory in much a way that's similar to a pap smear for a woman. And abnormal cells can be diagnosed that way. More invasive ways to look for cancer include thoracentesis, that's putting a needle in the chest and drawing fluid from it, bronchoscopy, which is to put a lighted tube into the airways and actually look around directly, and mediastinoscopy, which means putting a lighted tube within the chest through an incision, and pleurocentesis, which is to draw fluid from around the lungs and study that through a microscope. There are no standards as to which ones of these are employed. These are decided upon basically in consultation with your physician.
Very good. Thank you, Doctor.